All right, we've got another beautiful dissection here from Dr. Trinan. Posterior compartment of the leg. We can nicely see here is the medial side of the lateral gastroc head and the lateral side of the medial gastroc head. Got our neurovascular bundle in here, which we'll see, I think, closer in a moment. And I think we've got right in here is our sural nerve. So this is a right leg. And we'll also do the plantar foot. And we're going to internally rotate so we can see a bit more. The posterior compartment has more interesting structures on its medial side than on its lateral side. So this would be the edge of medial gastroc. You can see soleus very nicely here. This would be the posterior tibial artery and the tibial nerve pulled up from deep. What I very much like here is on the medial side, we can see this is the tendon to the flexor hallucis longus, and I think we mentioned this in class. You can see how FHL, we can see some of these striations of muscle, even way down here in the area where the medial malleolus is, which is a little bit different than other muscles like this one right here, which is the tendon for tibialis posterior. So you can see that TP is coming from deep. This is the edge of FHL here, and you can see TP coming from deep. And this is consistent with our Tom, Dick, and Harry. We would have medial malleolus here, Tom, tibialis posterior, Dick, flexor digitorum longus, and A-N-D, Harry. So here is our artery. Nerve is right in here, and I think back in here we can see some of Harry, which is the flexor hallucis longus coming in there. All right, let's keep going. So if we take a look at the plantar foot here, this is a beautiful job. It's a difficult dissection to do because there's so much fascia. And I don't mean just the plantar aponeurosis, which normally would have been right in here. The septa have been cut on the aponeurosis because remember the aponeurosis has anchors onto the first and fifth metatarsal. But Dr. T has also done a really nice job of getting rid of the plantar fascia that would normally be covering, like in this case, this is the abductor hallucis right here. Got a nice tendon to flexor hallucis longus here. All right, very pretty. So all of this is flexor digitorum brevis. So that's pretty. You can see the tendons to brevis right in here. These are the ones that are going to split as they get closer out here to the toes, so that the flexor hallucis longus, which is deep, can pass through it to get to the distal phalanx. All right, so this is real pretty in here. Quadratus planti, all of this. We have the tendon for the flexor digitorum longus. Tendons come way out here. Now the tendons for flexor digitorum longus, we can't see all that great in here because we have such nice, big, beautiful lumbricals in here. So you recall the lumbricals, just like the lumbricals that we talked about in the hands. These are doing MTP flexion with extension at the IP joints through the extensor hood mechanism in the toes. It's not quite as sophisticated as in the fingers, but it's a similar principle. So pulling up, oh wow, look at that. Pulling up the last bit of the flexor digitorum brevis to be able to see this beautiful quadratus plantae right in here. And here we can see a little bit better the tendons of the flexor hallucis longus. You can also see in here a very nice abductor hallucis. And here is somewhat bigger than usual abductor digiti minimi. Nice big extensor hallucis longus tendon. And if we look right here at the tip of the probe, right here is the sesamoid bone, the medial sesamoid bone. There probably would be one right over here. These are the heads of the flexor hallucis brevis, the muscle belly right there. Here's the other muscle belly right here. Remember, that's a bipennate muscle. See the lumbricals, very pretty here. So coming back up to the tibial nerve and the posterior tibial artery, passing through the tarsal tunnel deep to our abductor hallucis. And oh, what do we have there? I think this would be the part of the medial branch. It's the medial plantar nerve. This is probably the lateral plantar nerve over in here. Yep, there we go. Lateral plantar nerve. Big abductor digiti minimi. Wow. Going in deep here, we can see a little bit better the flexor hallucis brevis, at least one part of the bipennate structure of it. Beautiful quadratus plantae, lumbricals, tendons of the flexor longus, flexor digitorum longus. Getting into a smaller space now to get in, see things that are deeper. Okay, we've got a little bit different video here. Now we're going to look a little bit more in the posterior leg coming down, coming up to the posterior thigh. A very nice representation here of our common fibular and tibial nerves. Sometimes we see the sciatic nerve split real far down. Sometimes we see it real proximally, and this one is way proximal. Really nice right in here. You see several branches. The main trunk for the tibial nerve is going to be this guy right here, but we've got some muscular branches in here, and we also have got some superficial branch right here. What could that be? Look at this beautiful sural nerve all in through here. It's very nice. There you go. That's good dissection right there. It's Look at how far down. I love this. Look at how far down that goes. And then the sural nerve splits as it comes more distal, and it gets the whole lateral portion of the leg, the ankle, and then even down into the foot. Beautiful job. So we're looking at the popliteal artery and vein. What's this guy right here? Can't be the lateral head of gastroc. Oh. What do we have deep in here? Very nice, Dr. T. Popliteus muscle. You know it's popliteus and not plantaris because it's deep to our neurovascular bundle here. Very nice. Popliteus, it's internal rotator of the knee. And oh, look at that. Is that tibial nerve there? No, that's the freshman nerve. And you know that attaches into the plantaris. It's a very nice plantaris right there. Look at how much more superficial that is compared to the popliteus. Got a very nice gastroc. And soleus. Medial view of soleus. We're getting into Tom, Dick, and Harry.